Thank you very much, Susanna. And good morning again to everyone. Actually, as I'm speaking to you today, my people in the occupied territory and in Gaza are still under fire. No ceasefire for over 3 months and a half now. And the Palestinians are facing an unprecedented situation of genocidal acts, genocide, war crimes, and wars against humanity. Crimes against humanity. And if I want to say about the gendered impact of the occupation and the Israeli policies, we should not only start with the 7th of October, just to point out, but it has been exacerbated. It was disproportionate. It was indiscriminate bombardment and shooting and attacks on the Palestinian civilian population, resulting in most of the casualties among the Palestinian civilians. And especially women and children. It is not by coincidence that over 1.9 million Palestinians have been forcibly displaced and had to shelter in different locations for one time or several times, mostly women and children who have been not safe at homes and bombarded in civilian locations, as well as schools, at hospitals, at mosques, at churches, everywhere in the Gaza Strip. So we're talking about the high casualties. Over 24,000 Palestinians have been killed. Of them, there are 10,300 children and 7,100 women, meaning that 70% of the casualties are among women. The other remaining casualties among men resulted in additional responsibilities on women. This is the responsibility. They are becoming the main head households of the family. They have to maintain for their family within their traditional roles. They have to ensure that the children are being given food, medicine, taking care of the elderly, the sick and the injured. And persons who are becoming disabled, especially among children. We have limbs that have been amputated for over 1,000 children so far. Those who did not die are still facing. So these are all crimes that women were sheltering in Gaza. We know that when they went to, this information we are gathering, and we work in that way in our organization, is we depend on evidence-based data that we collect from the field. But it was challenging during the evacuation because our field researcher, who lives in the northern part of Gaza, left Gaza with her 3 girls to the southern part alone, without other members of the family, without her husband, to the southern part of the Gaza Strip, and was bombarded on the way to the first sheltering in the middle part of Gaza and then in the southern part of Gaza. So there was no safe place. She met with the women and started to document cases and bring them to us. We still need to do more. Our other field researcher needs psychosocial support, and we were not able to gather information from her. What women said about the evacuation orders that were made the second week of the land operation, Israeli land operation, because their homes have been destructed, they went to shelters. On their way, the genocidal statements made by the Minister of Israeli army or occupation army was from the beginning that they will deprive the Palestinian people from food, fuel, and water, clean water for drinking. We're talking now about starvation in Gaza. They eat only one meal, and the mothers even became so protective of their children. In one of the stories, a girl speaks, I saw it yesterday, she says that I close my mouth with a blanket when I'm hungry in the night because I don't want to make my mother worry more about me because I'm hungry. The people are not getting the necessary humanitarian aid. They're drinking dirty water, salty water from the sea, and are getting many diseases and in their stomach and in their systems. And the whole medical the situation in the shelters are very difficult because the people are living 40 people, 50 people in one room. They're overcrowded without the minimal needs of the ordinary fundamental needs of any person. So we are talking here, this is the room of our field researcher, and it really reflects how the people are trying to resolve the problem of absence of hygiene, clean places, bathrooms, and they're making this, in this photo, if you see, they made their own toilet from the sand and put it in, because it is overcrowded with very limited it's so hard for women to queue for 3-4 hours to go to the toilet. Many of the women do not have the hygiene for their monthly menstruation. They found contraceptive pills, which they try to get in order to avoid the natural monthly menstruation. And many of the pregnant women have given birth, you know, in very difficult situations. Ala and her family were terrified from the phosphorus and chemical fumes that might affect her baby when she was pregnant. She sheltered in a school with 40 people where they were living, and Ala went into the labor, but the family had no phones to call the ambulances, and her family could not move her to, later she was able to be moved to the hospital. Ala and her baby, you know, in hospitals, we're talking about over 50,000 pregnant women, 5,000 giving birth every day, every month, 180 every day. C-section, because of the situation, they get very troubled, and therefore they're giving birth. The labor is not working, and many of them need C-section operations, and these C-section operations are not resulting in they're done without sterilization and without even any kind of anesthesia. You can imagine the sufferings of the people with malnutrition and with the absence of the minimal needs of the family. Not to mention that there's no maternal reproductive health services, no hospitals functioning, hospitals being targeted, and over 190 women were abducted by the Israelis. When they night raided the northern part of Gaza, one of the video showcases shows an Israeli soldier saying, you know, showing the underwears and lingerie of the women and saying, I have been always saying that Arab women are sluts. And this is the kind of written language on the walls in the rooms, and the sexual harassment of the abducted women to Israeli prisons and detention centers. We're talking about 190 women, isolated, starved, beaten, threatened with rape, and all of that happening while, you know, the negotiations in 1 week on releasing of women political prisoners, but they have arrested more than double the number of the women that have been in Israeli prisons and detention centers. So the situation, all of these are gender-based crimes, and I can go on and on, but I'm sure that there's a lot of information coming from international organizations, humanitarian organizations, the United Nations, and civil society organizations like ours. Thank you.
Thank you so much, Randa, for taking us through what is a heartbreaking and incredibly difficult situation. I wonder if you could speak a little bit about your organization, or about what feminist human rights organizations like the Women's Center for Legal Aid and Counseling are doing to try to meet some of the needs and priorities of victims and survivors. So a little bit about your work.
Actually, first and foremost, under the current situation, we are specifically based in the West Bank and in occupied East Jerusalem, and we have our field researchers in the Gaza Strip. So monitoring and documentation of violations, because most of our work on international advocacy is very much dependent on first-hand information that we gather from the field, and we think that this is the way to do it to continue to do it. We are joining hands with other human rights and humanitarian organizations, international and national organizations, to provide the necessary humanitarian needs and set forth the priorities and needs of Palestinian women, specifically on the forefront and on the priorities, because they might be undermined or overlooked, and they're not seen by some. And I've heard that, that they are not the priority. So there was a demonstration in Cairo with the Arab women. We tried to also to work within the MENA region through a network that we have, the Arab CSO and Feminist Network, which is supported by UN Women. We tried to there was a demonstration that they were saying the hygiene kits for women are not secondary needs, they are priorities. So we were having stand-ups, doing advocacy at the international level, trying to bring our voices higher. We are trying to be present in international forums. We are trying to gather and monitor and document continuously all the violations in the occupied territory, including Gaza Strip, in order to be able to make the perpetrators, the Israeli occupying authority, accountable for those crimes. We will be contributing to first of all, we developed a contingency plan, and the idea is that we want to work with women, with the victims and the survivors. We are not in a situation where we are in a higher position to know more of what women in the Gaza Strip need. So it is them who are going to be engaged with us. It is very important not to impose what they need. So we want them to set up their rights and their priorities and their needs at the forefront. We want them to have meaningful participation. So we want to ensure that, unlike the previous times when there was reconstruction of Gaza after Israeli military aggressions, women were relegated back to their traditional roles and unpaid healthcare duties. So now we are trying to ensure that they are in the decision-making, they are not neglected, that they are saying their word, that they are part of the women, peace and security component of the reconstruction of Gaza, of prioritizing their needs, of those women who are, we had 11% of the women heading the households prior to the war. Now this is increasing to up to 14% or 15%. And this really means that economic empowerment is very important. So we have to also engage in that. We have to think of advocacy campaigns to provide the reproductive sexual rights and health rights of women, which are completely absent with the absence of infrastructure. And last but not least, we're preparing cases for the ICC, and we want the victims to file their complaints, because now we have a portal open for women, and I think women and victims to file their complaints, and therefore for the investigation of the crimes that are being committed. And we want really to work with the other human rights organizations who might marginalize the gender crimes or the crimes that have a gender component. So we want to ensure that this is brought to the forefront, to the ICC, to the Independent Commission of Inquiry that has been established in 2021 after the Israeli military aggression on Gaza. In May 2021, and we want to work with the ICJ as well and provide the data and information and the reports and submissions that are necessary to back up the information and evidence-based data. This is what we can do. We are not a humanitarian organization. We help the women who were referred for medical care in the West Bank and Jerusalem, and we try to support them because they were abandoned. They were accompanying their children for chronic diseases, or they themselves were cancer patients or kidney failure patients. But now many of them prefer to go back to unite with their families under the current situations and causing the difficulties of so being in the West Bank, these women were abandoned completely, away from their families, worried about their families, and we did all our best to ensure that they are being supported by my organization and other numerous feminist and women-led organizations. Thank you very much.